Two things to start today. One, we have a district championship, region championship. Well, districts were last night, so ignore my attire for today. I did think about that when I got dressed this morning. Today we're going to wrap up. We're going to talk about the different arteries and veins, and I will give you specific ones that you need to know. So body's blood vessels can be divided into pulmonary circuit. Pulmonary means lungs. So pulmonary circuit deals with blood to the lungs and back from the lungs. Systemic deals with system or entire system. So it's the vessels that are going to go to the entire body and back, including the coronary circulation, which is part of your heart. So I want to point out this diagram, you should know all the parts on this diagram. For your test, I said a lot of the pictures will be on cadavers. It won't actually be a diagram like this. I'll give you some hints there too. But here I want you to notice one thing. Arteries carry blood away. They're red. Veins bring blood back. They're blue. There is one set that's opposite. So if I look at my pulmonary trunk, this is a pulmonary artery, this is a pulmonary artery. They are what color? Blue. They don't have oxygen yet. This is the only artery that's going away from the heart that's blue because it doesn't have oxygen yet. It picks up oxygen in the lungs, comes back to the heart through veins, and these are red. So your pulmonary arteries are blue, your pulmonary veins are red, dealing with their oxygen content. Those are the only ones that will appear that way. Pulmonary circuit, vessels that take blood from the right ventricle through that pulmonary trunk, through the blue pulmonary arteries to the lungs, goes into the capillaries of your lungs, picks up oxygen, and then it's going to go back to your heart. This might be cutting off a little bit. So there is kind of highlighting the pulmonary circuit. Systemic is going to go to the entire body. Basically, the one diagram was the most important part there. So now as we start to look at specific labeling arteries and veins. The aorta, largest artery. This whole page you're responsible for knowing. The aorta you should be able to pick out. Principal branches, ascending aorta is going to go up. It's going to go to your coronary arteries, the heart muscle, and then it's also going to go brachiocephalic, arm and head, left common carotid, carotid's going to go to your head, and then left subclavian, they sit right under your clavicle. And we'll have a diagram to look at those. Descending aorta goes downward, also called the thoracic aorta. It sits behind your thoracic cavity, gives rise to many small arteries. Abdominal aorta is going to be in your abdominal area, and it sits underneath your organs. Celiac, superior mesenteric goes to mesentery. Suprarenal means on top of kidney. Renal deals with kidneys. Gonadal deals with gonads. Inferior, bottom mesenteric. And then your common iliac are going to be by your ilium bone, and they are going to branch off in your hip region. So, as I look at these, your carotid arteries you should know. Carotid you should know. Subclavian you should know. Brachiocephalic, aortic arch you should know. And notice I'm right and left. You should know that you should know both sides. So as I'm coming out of the heart, the aorta is the branch that comes out. The aortic arch is what's going to come off of there. Your carotid arteries are going to branch off and come up into your neck region. Brachiocephalic is where it first comes off of the aorta. That's the brachiocephalic on both sides. This is going to branch into a carotid artery, and this is going to go under your clavicle to your arm. And we'll actually also look at your arms. Gastric deals with digestive. I might have that on there. Hepatic for sure. Hepatic deals with liver. So your hepatic artery is going to go to your liver. When we get to veins, there will be a hepatic vein. So if you memorize one, you really learn both. Because there will be the there will be the right subclavian artery, there will be the right subclavian vein, and they are right next to each other. Suprarenal is going to enter the top of the kidneys. Renal goes into the kidneys. Gonadal is going to drop down towards your gonad region. And then iliac is going to be where it branches off of your descending aorta. So your two iliac arteries and your two iliac veins are the main branches that lead down to your legs. So here you can read through that. I'm not going to show that. Head, neck, and brain. Arteries to the head, neck, and brain mostly come from your subclavian and your carotid arteries. Vertebral arteries are going to take blood supply to the vertebral area. In the cranial area, the vertebral arteries are going to unite to make a basilar artery and then posterior cerebral arteries. I will not have you label these. As far as in the skull and face, I will not have you label those, but you should know the main branches that lead there. So your carotid arteries and your jugular veins, you should know. So here, I do want you to be aware in your brain you do have blood vessels. So here's those vertebral arteries that are going to branch up, becomes the basilar artery, and then that's going to branch off into many arteries that are going to feed or take blood to your brain. Thyrocervical arteries are short. These I won't have you label. 6 you will. So the right and left common carotid arteries diverge, they break off into an external carotid and internal carotid. Internal carotids are the main branch that's going to go to your brain. Near the base of the internal carotid arteries, there's the carotid sinuses. They do contain some baroreceptors to monitor blood pressure. And here's a diagram. So notice here, as I come up, here's my common carotid. It's the first large vessel that's coming off of the brachiocephalic trunk. Common carotid, and it's going to break into external and internal. The external's on the outside, the internal's on the inside. The external's a little bit bigger. What else? Do remember when you're labeling on papers on your test, everything that you look at is backwards. So if you're looking at a diagram, this is, even though it's on your left side, it's the right side. So make sure, we'll get to another picture where I can show that. Here maybe. Axillary, subclavian artery. Axillary deals with like the armpit area. So that will be the axillary artery. Shoulder, brachial, you should probably know. Brachial deals with arms. And then the ulnar artery is going to be on your ulnar side. The radial artery is going to be on your radial side. Notice a lot of these names match with the bones that they run along. So subclavian, under the clavicle. Iliac veins, the ilium or the iliac crest, the iliac region. Thoracic deals with your thoracic cage. So right now, if you were going to label this, is this your right or left subclavian artery? Right. So when you're looking at it, it appears to be the left side. Remember, the body's always facing you. This would be the right subclavian artery. This would be a fairly good, so subclavian branches off. Axial is where it kind of goes through the armpit region. Brachial is going to come down the arm, and then it's going to break off. And my ulnar artery is going to be on my pinky side, and my radial artery is going to be on my thumb side. And I think I'll stop there and break it apart so that I can post all of these. We'll start next with the abdominal area.